I presented some work that we have been doing in assessing how different cancer specialists, whether they're dermatologists or head and neck surgeon, medical oncologists, surgical oncologists, radiation oncologists, how the different specialties may view risk profiles for tumors, what the general approach within the specialties is for these different stage tumors. Many centers that have multidisciplinary tumor boards, they work together, may have consensus, but across the whole of specialties, we were able to identify that between dermatologists who see a vast majority of these tumors and have done a number of the work around assessing risk and improving some of the staging guidelines related to tumors, that there is some differences between their assessment as well as the other cancer specialists, head and neck surgical oncologists, radiation oncologists. And so this leads to some fractionated approach or kind of divergent approach for care, depending on who the patient sees and maybe regional differences as it relates to this. And this is something that we've known for some time because squamous cell carcinoma, especially high-risk squamous cell carcinoma, hasn't been studied as much as melanoma. It's not, there's not a national database in the US related to this. And so we have some questions as to how much emphasis we should put on various risk factors, and then as a result, how to treat those patients. And so I discussed some of those differences as well as some areas where there is consensus, and then built upon that by a study that we did looking at developing a Delphi consensus, a consensus guideline based on staging among these various experts, 75 experts in high-risk squamous cell carcinoma. And so we provided a baseline for those guidelines that we hope to then investigate further, identified areas that we need to have clinical trials to either prove that those consensus guidelines are accurate, or where there isn't consensus, maybe be able to come to consensus among the different specialists.